Good Thursday evening, everyone, and thanks for joining us for Western Mass News at 6. I'm Chris Pisano. Let's take a quick look at what's making the latest coronavirus headlines. More than 70,000 people here in the Bay State filed new unemployment claims last week. Overall, more than 722,000 have filed during the pandemic. Small businesses are trying to receive funds from the second wave of the Paycheck Protection Program. And colleges here in Western Mass are weighing their learning options for the fall semester. With jobless claims at record levels, the coronavirus pandemic is hitting small businesses especially hard. Here in Western Mass, while many businesses are struggling to get loans from the Paycheck Protection Program, others are concerned with the amount of time it takes to access the money and with the burden of adding yet another loan to their debt. Western Mass News reporter Audrey Russo joins us live in Springfield with more. Audrey?
According to FEMA, 40% of small businesses don't reopen after a disaster. And while it's not the same as a weather event, the coronavirus is having a disastrous effect on businesses, many of them small, local Main Street operations deemed non-essential.
You have to pay for the rent, the food, and then buy something extra like clothes.
Eddie Rivera understands that a lot of people can't afford to buy extras like clothing and accessories right now. But even if they could, Rivera must keep the doors of his Holyoke fashion store closed because it's a non-essential business in the coronavirus pandemic.
Between rent and utility, and see, we don't have no cash flow, coming through.
No cash flow coming in, and Rivera tells Western Mass News he has extra inventory that he bought in anticipation of the Holyoke St. Patrick's Day Parade, which was then canceled because of the virus. Rivera says he's concerned by the wait times and the application process for government small business assistance programs.
I understand it's a lot of program to hurt the small business, but we have to get it online, we have to wait.
Without the traffic in his high street store, Rivera says he's begun questioning his options.
In this particular case, maybe I can consider to close the business, to go out of business.
We have not had a bus on the road since March 15th.
Dennis King says he had to lay off many of his employees from King Ward coach lines in March. Since then, he's received some good news from the Paycheck Protection Program.
We did receive some PPP money. We are in the process of calling some staff back now.
But King says even the PPP loans can only help so much before they start to harm a business.
Yes, they're offering loans, but how far in debt and how much loans can we continue to put on our company? We need more than just another loan.
He believes the federal government needs to do more.
The airlines got bailed out, Amtrak got bailed out. We're a very, very important part of the transportation industry.
Now, King says he'll soon send some of his own buses down to Washington, D.C. to take part in what he calls a mobile rally to show federal lawmakers that his industry still needs help. Live in Springfield, Audrey Russo for Western Mass News.
Audrey, thank you for that live report. Governor Charlie Baker today addressing contact tracing efforts here in Massachusetts. So far, the state has made contact with about 5,000 people. And from the work being conducted, officials say the coronavirus stay-at-home restrictions are having a positive impact.
Originally, when we first started putting this together, we projected that a person would have around 10 contacts that would then need to be contacted. So far, the average number of contacts is actually only 2. That's a very good sign because it means that the work all of you and we have done here in Massachusetts to stay home, to separate, to socially distance, and to take seriously this idea that all of us have a role to play in reducing the spread has made a big difference.
The governor urges people to answer calls from the Massachusetts COVID-19 team, which will come in from an 833 or 857 number. It's important to answer because it means you have been in contact with someone who's tested positive. The Mass Department of Public Health releasing the latest numbers, and so far, 275,647 tests have been conducted, with 10,029 tests done just today. The DPH confirming 2005 cases today. 3,562 people have died from COVID-19, with 157 new deaths reported today. And breaking down those numbers county by county, Here in Western Mass, Hamden is reporting 3,777 coronavirus cases. Hampshire County 546, Franklin 257, and Berkshire County 442. In total, the 4 counties are reporting 5,022 COVID-19 cases. Tonight we hear from the front lines inside Cooley Dickinson Hospital in Northampton as they keep up the struggle to care for coronavirus patients. Western Mass News reporter Alyssa McCann spoke exclusively to a respiratory therapist who explains just how difficult this pandemic has been on the small hospital.
No, it's pretty scary times right now.
Jennifer Shea has been a respiratory therapist for the last 20 years, but her most recent work with patients battling with COVID-19 at Cooley Dickinson Hospital has been the most difficult.
This is definitely, we haven't seen this, and it's pretty scary. It's emotionally and mentally scary. We've seen, we're having patients come in much sicker and quicker, deteriorating.
For a hospital about a third the size of Bay State, the numbers tell the story. Cooley Dickinson has a total of 130 beds, 11 of them ICU beds. As of Thursday at noon, they had 14 patients being treated for COVID-19, 5 of them in the ICU, the highest number this week. Shea tells Western Mass News those patients in the ICU struggling to breathe require respiratory therapists to administer oxygen, playing a vital role in their recovery.
We can be putting on BiPAP, which is a mask, to help initiate that breath. We're doing high flow nasal cannula, which is a high liter flow of oxygen. And sometimes if their breathing is pretty bad, we're having to put them on a ventilator, which is also life support.
She also described how damaging the virus can be to the lungs.
It's basically mimicking almost like a really bad pneumonia. They're coming in, their lungs are filling up. So a lot of times on a chest x-ray, you see the rib cage, you see like the sternum, and you see the air, which is usually gray. And when someone has COVID, it's basically just white cells.
There are patients recovering from the virus at home, but they still are relying on respiratory therapists for advice and suggestions.
Don't just lay in bed for, a couple of days or on the couch. Repositioning is a big component. Laying on your stomach, trying to do that as much as can be, which is called being in the prone position, rather than being supine, which is looking forward, laying on your back. Repositioning, staying hydrated.
Even through the dark times, Shea says they have had patients make a full recovery.
We have about 7 or 8 that have over a couple of weeks, about 2 to 3 weeks, close to a month, they've been able to get discharged.
For Western Mass News, I'm Alyssa McCann.
A signal from UMass Amherst as they weigh their learning options for the fall semester with the future of COVID-19 still uncertain. Western Mass News reporter Lindsay Kane getting answers for us and joins us now live in Springfield with more on that. Lindsay?
UMass Amherst is planning to provide education in the fall, but what that looks like is still uncertain. Colleges and universities across the country are keeping a close eye on the COVID-19 pandemic to figure out what the best method of education will be, keeping students' health and safety in mind.
UMass Amherst is going to be here. We're going to be delivering education in the fall. The question is, what is the mode? What is the setting?
Ed Blagozewski, campus spokesperson for UMass Amherst, tells Western Mass News over the phone that there are still multiple ideas for course instruction floating around.
We plan to be up and running in the fall, just as we are now. It may range from everybody being back on campus to remote learning to something in between.
He says officials are looking into giving students the option of coming back to campus if allowed and doing a full semester of online learning.
We have students from across the country and across the world, and they may choose not to travel all the way back here.
The university is working out ways to make sure students are not sharing equipment in laboratory settings, are spaced out properly in lecture halls, and are looking into proper facial coverings. As for dorm living, where social distancing is harder to maintain, the university is still in the early stages of planning for what that will look like.
Students in residence halls need to be given the appropriate guidance and support that they need. And, we're going to be studying that a bit more.
For now, Blagozewski says officials are continuing to monitor the situation and state protocols.
It may be a while before we get good enough clarity to come down and make a full decision. But what we want
Plagaszewski says they will make a decision at some point this summer. Live in Springfield, Lindsay Kane, Western Mass News.
Lindsay, thank you for that live report. And for more coverage on the coronavirus emergency as it continues to develop, log on to our free Western Mass News streaming app. Coming up on this Thursday, blood plasma donations can help save the life of those battling COVID-19. More on how the local Red Cross is seeking donors. And also still ahead, teachers in neighboring Connecticut urging officials to push the closure of schools until the end of the academic year. More of those details straight ahead. Jacob?
And we are tracking some light showers up through Route 202 into 116 as you go towards South Hadley, Belchertown, New Salem, Shutesbury, Orange. You're seeing some of those light showers. More on the way heading into tomorrow. A look at our Skycam shows the overcast and dreary skies overhead. We'll look at the forecast after the break.